one of the things I think about a lot and talk about a lot with clients is recognizing that pain is not something to just necessarily avoid or get rid of, but it's actually something it's an important part of the body that's telling us when something is not quite right. So any kind of chronic nagging, uncomfortable sensations will, it's the body telling us that something isn't right. It's really difficult sometimes to figure out what that is, because we will tend to take Tylenol or some sort of over-the-counter pain reliever, but that's not actually doing anything for what the body's trying to tell us. It's just muting the message, right? So I would say in a lot of cases, any kind of chronic pain is a call for some kind of massage or body work. Because the way that I approach it, I like to say, because everyone is so different, even though we all have the same pieces and parts, everyone has them in their own way. And so when I work with people, it ends up being a lot of like detective work, right? I sort of gather as much information as I can from them about the specific issue that they're having, the history of what they do, their level of activity, what kinds of injuries they've had, all these kinds of things. And then actually, once I get my hands on them, start to work with investigating different ideas about, okay, so it's really clear that this needs to be released. And sometimes when you release one area, another area shows up a little brighter, So there's definitely a progression and a process that comes with it. And there's no recipe that fits everyone, just because everyone's so different.